Hi, good evening everyone. My name is Abhirami Anaprabhat Undimutu. I'm from Ipoh Learning Center. My lecturer who guide me to do my research proposal is Dr. Mazani bin Muhammad Yusuf. My research topic is effectiveness of infection control training program for emergency department staff. In a hospital, emergency department is the busiest department with a high turnover of patients. It's a very high risk area and the risk of exposure to infectious agent is very high. It's very crucial for a healthcare staff to follow infection control protocols such as PPE, hand hygiene, and isolation protocol for infectious cases. It is important not only for the healthcare staff but to protect our patients. Problem statement. Lack of assessment tools. Basically, in hospital sector, we'll conduct infection control training, but there are no existing tools to evaluate the effectiveness of infection control training, specifically for ED personnel. So second problem statement is insufficient training. Most of the time, they will conduct infectious control training once in a year. So many ED staff receive inadequate training. This leads to the gap in their ability to prevent infection spread. So third problem statement is knowledge retention challenge. Initial training may not lead to long-term retention of knowledge and consistent application of practice. Existing literature. Infection control training programs are crucial in reducing healthcare-associated infections in high-risk settings like emergency department. Studies have shown that structured educational intervention significantly improve compliance with infection prevention protocol among healthcare workers. However, many training programs focus primarily on theoretical knowledge without adequately addressing practical skill, and the psychological factor influence adherence. Identified gap in literature. There is a lack of comprehensive evaluation tools specifically designed to assess the effectiveness of infection control training in ED setting. Previous research often overlooked the integration of mental health support and the continuous reinforcement of training, which are critical for maintaining compliance in high-stress environments. The purpose of this study is to fill this gap by develop a mixed method approach to evaluate the relationship between the knowledge retention and the practical application of infection control practice among assistant medical officer and nurses in emergency department at Hospital Raja Permaisuri Bainon. Then this study will provide an actionable insight for improving training effectiveness and compliance. Somehow this will help to enhance patient and staff safety. Hypothesis 1. Infection control training will significantly improve knowledge and compliance among ED staff. Hypothesis 2. To study the relationship between the frequency of training and sustained adherence to infection control protocols. Variable. Independent variable, participant in infection control training. Dependent variable, knowledge level, compliance with infection protocol and perceived barrier. Methodology. My participant for my research is Assistant Medical Officer and nurses from Emergency Department at Hospital Raja Permaisuri Bainon. My total sample size is 40. There is some criteria for my participants are minimum 6 months of experience in ED and willingness to participate and provide informed consent. My development tool I'm going to use is questionnaire. There are total 50 questions. It's divided to part A, demographics, part B, infection control knowledge, attitudes and compliance. It's a 5-point like scale questions. Part C is training program evaluation, which is interview open-ended question. So the procedure for the research, first recruitment. So we did announcement for our staff, emergency department, and we received informed consent. Secondly, there is a questionnaire for pre-training assessment. Thirdly is a training intervention. including theoretical, practical, and psychological support, followed by the questionnaire for post-training assessment, and there is interview, including open-ended questions. Here are some reference we refer to complete our research proposal. So that's all my presentation today. Thank you.